This is a video on cardiac tamponade. This video is not about pericardial effusions or identifying them, so please see a different video for that. We will cover right ventricular collapse during diastole, mitral valve inflow variation, and IVC analysis. RV collapse is supposed to be between 75 and 85% sensitive and between 80 and 100% specific. For right ventricular collapse, we're going to get a periosternal long view. We're going to look at the chamber at the top, which is the right ventricle. We're going to look for when the mitral valve is open, which is diastole. This is where we're going to be looking for collapse when the mitral valve is open. With the video slowed down, we're going to pause right as mitral valve is opening, and you'll notice right here that the right ventricle is bowing in, which is a positive find for tamponade. Sometimes this can be hard to see, so if we throw M mode on it, we'll get this tracing where we can evaluate where the mitral valve is open, and you can see on the bar where the right ventricle can be collapsing. This clip actually doesn't show tamponade. However, if you look right where the right ventricle, these two lines, tamponade would show these two lines coming closer together like this, which would also be a positive finding. Another tool that we can use is mitral valve inflow variation. This is where you take an apical four-chamber view, you put a color view over the mitral valve, you identify the peak jet, then you place the Doppler at the tip of the mitral valve on that peak jet, and you start running and you measure the inflow variation difference between the maximal peak and the minimum peak, representing respiratory variation. And I do want to clarify that I'm using pulse wave Doppler here. Getting back to the measurements, but you take the maximum and the minimum, you find the percent difference if it's greater than 25%. This is kind of a surrogate pulsus paradoxus measurement. So again, greater than 25% is cardiac tamponade. In any analysis for cardiac tamponade, you should look at the IVC. The IVC should be dilated. If it is not dilated, please rethink your diagnosis. A good estimate is if there is no respiratory variation and it is greater than 2 centimeters. This is dilation. In summary, if you have a pericardial effusion, you can assess for cardiac tamponade using ultrasound. The things that I like to look for is right ventricular collapse during diastole, mitral valve inflow variation greater than 25%, all of this combined with a dilated IVC.